A small video on how to study and remember hypokalemia using mnemonics. So last video was on hyperkalemia. This video is on hypokalemia. So for those of you who have not watched the previous video, first we should know what are the basics of potassium. Hypokalemia is decrease in the serum potassium value. So why we need potassium? Where is potassium in our body? Potassium is an intracellular component. What do you mean by intracellular? It is inside the cell. So 98% of the potassium is present inside the cell and the sodium is present outside the cell. So this concentration gradient like potassium inside and sodium outside is maintained by a pump called as sodium potassium pump. And why we need potassium? It is mainly for the activity of the muscles and the nerves. So if there is no potassium, we know that the muscle is going to have severe pain, and it's not only the voluntary muscles, even the involuntary muscles like the respiratory muscles, the cardiac muscles, the GI motility, everything is going to be affected if there is hypokalemia. So we should know that potassium is excreted by kidneys and the normal value is 3.5 to 5 milliequivalents per liter. If the serum potassium is less than 3.5, we call that condition as hypokalemia. Now let us see what are the causes of hypokalemia. There are a lot of reasons why a person can suffer from hypokalemia. Now the main reason are mainly five, okay, which we can remember by using a mnemonic. Your body is trying to ditch potassium, DITCH. So that abbreviation is going to be the cause for hypokalemia, ditch. So let us see one by one what is ditch. The first one is D. D stands for drugs. When a person is started on, say, diuretics, especially, loop diuretics or thiazide diuretics, there is a chance that serum potassium can be lost from the body. I mean, the potassium can be lost from the body. So, diuretics, laxatives, use of corticosteroids, all these things can lead to hypokalemia. Laxative because what to say, the stools which are being excreted, okay, when it is going to be of more, then what happens is the potassium level is going to decrease in the body. Next one is I. Ditch. D for drugs. I for inadequate consumption. Inadequate intake of potassium. Like, for example, if a person is going to starve because of anorexia, or if it is going to be a condition like nil per oral status, okay, when the NPO is for a long period of time, a person can end up with hypokalemia. So, inadequate consumption. Next is T. T stands for too much of water. Too much of water is because when there is more fluid level inside the body, what can happen is there can be dilutional hypokalemia. So when water content is more, actually the potassium may be normal, but in correspondence to the water content, the serum potassium may appear to be normal. That is called as too much water in the body. Next is C. C stands for Cushing syndrome. I hope you remember that in hyperkalemia we studied that Addison's disease is a cause for hyperkalemia. You remember that there we study the mnemonics, the body cared too much for potassium. So CARED, A stood for Addison's disease. So here it is opposite, Cushing syndrome. So in Cushing syndrome, we know that excess of cortisol is there. So sodium and water retention will be there. Automatically, there will be a loss of potassium. Okay, whenever we should understand one thing, sodium is inversely proportional to potassium. Whenever sodium content is going to increase, the potassium will decrease. Usually it is like that. So sodium reabsorption and potassium excretion can happen in Cushing syndrome, ending up with hypokalemia. The last one is H. H stands for heavy fluid loss. Heavy fluid loss can be because of, say, vomiting, diarrhea, excessive nasogastric tube suctioning, wound drainage, even profuse sweating can lose potassium from the body. Okay, so these are the various reasons for hypokalemia. So, how should you remember this? Using the mnemonic that the body is trying to ditch potassium. What is ditch? D stands for drugs, I stands for inadequate consumption, T stands for too much of water, C stands for Cushing syndrome, and H stands for heavy fluid loss. Next, clinical manifestations. Again, it is easy to study and remember the clinical manifestations of hypokalemia. You just have to remember the mnemonic slow call. Okay, it's very easy to remember this because in potassium, every organ and every part of the body is going to become slow and low. It is going to be slow. It is going to be low. Okay, so how do you remember it? You can try a mnemonic slow call. So let us see what are the abbreviations of slow call. First, let us see what is slow. Slow, it refers mainly to all the vital signs in the body. So number one, respiration. If you're going to see, the respiration becomes shallow, pulse rate becomes decreased, bradycardia. There can be orthostatic hypotension. There can be weak and irregular pulse. Okay, it is a weak pulse, it is an irregular pulse, so we know automatically the patient is going into arrhythmias. Okay, an irregular pulse is indicating what? It is indicating arrhythmias. So here the main ECG changes, if you're going to see, it is prominent U wave and there is an inversion of T wave, or there is a shallow T wave, or you call that as inversion of T wave, and ST is depressed. ST segment is depressed. So these are the rhythm changes which we see in ECG for a patient with hypokalemia. Do you remember in hyperkalemia it was tall peaked T wave, whereas here it is prominent U wave and inversion of T wave, or a shallow T wave and ST segment depression. So I hope this is very clear. Slow is very easy to remember. Remember all the vital signs. Okay, mainly the pulse, the respiration, and the blood pressure. Respiration is decreased, pulse is decreased, BP is decreased, and same way we find that there is arrhythmias. Next is call, CALL. C stands for cramps. I hope you remember that the function of potassium is for what? Muscle activity and nerve activity. So when that is not taking place, what will happen? The patient can have cramps, especially in the legs. Okay, cramps and confusion can be seen. Next is arrhythmias. Okay, A stands for arrhythmias, to highlight and say it is an arrhythmia. Okay, next is L. L stands for lethargy. L stands for lots of urine output. Okay, so if you're going to see, mainly the person is highly tired when the potassium is going down. The person can have a lot of urine, can be excreted. Okay, so these are the clinical manifestations which you have to remember. So what is a mnemonic? Slow call. Slow stands for all the vital signs. C stands for cramp. C stands for confusion. A is arrhythmias. L is lethargy. And again, L is lots of urine. So we have completed the cause, the clinical manifestations. Let us see how to manage this patient. Now, any student will be able to write this answer because whenever potassium is low in the body, what should be done? We have to supplement potassium, is it not? So, even before we go for supplementation, you should always put a patient on a cardiac monitor because it's not that serum potassium is decreased. I am not bothered only about that. I am afraid about the potassium which can affect the cardiac muscle, okay, which can end up with arrhythmia. So that is why we have to put the patient on cardiac monitor. The next thing is we have to watch equally other electrolytes because whenever potassium is less in the body, usually it is found that the magnesium content is less in the body, the glucose, the calcium, the sodium, all these electrolytes should be carefully watched because usually we find that whenever potassium is low, magnesium is also low. So what should be done? We have to do a magnesium correction also for a patient with hypokalemia. Next is we have to supplement. So one thing is monitoring, another one thing is whether it is only potassium or whether any other electrolytes are being affected. The third thing is we have to supplement. How to supplement it? There are oral supplements which are available. If a patient is conscious, if the potassium is only slightly low, say for example normal is 3.5, if it is 3 or 2.9 or something like that, oral supplements can be given. Like we have we have chelate syrup, we have pot chlor syrup. But only concern is whenever a patient is taking potassium orally as a liquid, okay, it should be diluted in water, number one. Number two, it should be taken after a good meals because it usually causes gastrointestinal irritation. Okay, so that is one thing which we should remember whenever we give potassium supplements to the patient. Think about GI irritability and always dilute it and give it in one glass of water. Then number two is we can supplement it by food. If the potassium is say slightly decreased, okay, then we can tell the patient to take potassium rich foods. So last video also I told you like potatoes, oranges, tomatoes, okay, avocados, muskmelon, mushroom, all these are the foods which are rich in potassium. Even spinach and green leafy vegetables are rich in potassium. So banana is an excellent source. Tender coconut water is an excellent source of potassium. So supplementation. Next is, suppose if the potassium is say too low, if it is less than 2.5 milliequivalents per liter, then maybe oral supplements alone will not help. So in that case, we have to supplement the potassium intravenously. But please, please, please remember, potassium should never be given as direct intravenous infusion. If we are going to give it as direct intravenous infusion, what can happen is the patient can go into cardiac arrest. Okay, so please be careful. Never give potassium intravenously as a bolus dose. Always you have to dilute it, okay, and then you should give it only by an infusion pump. It should be given only by an infusion pump. Never give it intra direct. IV should not be given, IM should not be given, subcutaneously it should not be given. Okay, so potassium should not be given IM, subcutaneous or bolus. It should only be diluted and given by infusion at the set rate. Say for example, by it's usually given, like 10 to 20 millimoles per hour. But if you are going to give more than that, please make sure that the patient is on cardiac monitor. Okay, now usually we find this is the maximum dose 10 to 20, but if it is going to be more than 20, then cardiac monitoring and ECG changes should also be equally monitored. Then another one important concern when we give potassium intravenously is that patient can suffer from phlebitis because it is a highly irritating drug. So always watch for phlebitis if a patient is on potassium infusion. Watch for phlebitis. If there is phlebitis, please stop the infusion and inform the nursing in charge. Okay, you have to watch for phlebitis. Next is, if the patient is already on say Lasix or thiazide diuretics, we may have to stop the diuretics and start the patient on a potassium sparing diuretics like spironolactone. Why? Because Lasix side effect is hypokalemia. Thiazide diuretic side effect is hypokalemia. So we may have to start the patient on spironolactone. Very, very important question. Very, very important point which we should remember is when a patient is suffering from hypokalemia, please don't give digoxin because digoxin can end up with toxicity whenever the potassium level is low. Okay, so please be careful. If a patient is a cardiac patient is now at present suffering from hypokalemia, patient is usually taking digoxin, withhold digoxin. Otherwise, patient will end up with what? Digoxin toxicity. So it is very easy to manage. We have oral supplements, we have foods which can be given to the patient. We can give intravenous infusion dilution under cardiac monitoring. Then stop the diuretics and maybe the patient can be switched on to potassium sparing diuretics. So I hope this small video is very useful in order to study this condition, hypokalemia. So the key takeaway what you should remember is the mnemonic ditch. Ditch is the cause for hypokalemia and the mnemonic signs and symptoms slow call. Everything is slow, everything is low in hypokalemia and treatment is just replacement. And please watch the patient on cardiac monitoring. Remember about prominent U wave. Remember about phlebitis. Remember about GI irritability. Remember about cardiac arrest. These are the key points which you should remember in hypokalemia. So I hope and pray that this small video will be helpful, especially for students to easily study and remember hypokalemia. Thanks a lot for your great love and support.